guys, welcome back to Neskevin TV. On this episode, I want us to talk about common medical abbreviations and blood abbreviations that you need to know. You get confused when you see some abbreviations like the WBC, the RBC, and other forms of that. All these abbreviations are short form of something that we all must know as nurses, because mostly we are going to see these things on a patient bedside. We are going to see it on a medical documentation, or you're also going to see it on a prescription sheet. That's the reason why I want us to learn together. The first one that we are going to talk about today is the WBC. Anywhere you see WBC, it stands for the white blood cell. Then we have the RBC. The RBC also stands for the red blood cells. Then we have the HCT. When you see HCT, also stands for hematocrit. Then we have the PLT. The PLT stands for platelets. Then we have the MCH. So MCH also stands for mean corpuscular hemoglobin. The MCG stands for the mean corpuscular hemoglobin. That's the full meaning of the MCH. Then we have the FBC, which is known as the fasting blood sugar. Then we have the DS. So anywhere you see DX, it's known as what? Diagnose. Then we have the LFTX. The LFTS also stands for liver function test. Then we have what? HR. So it stands for heart rate or pulse rate. We talk about how the heart is on. Yes. Then we have what? The RR, known as the respiratory or the respiration rate. Then we have what? The HB. The HB also stands for hemoglobin. Then we have the CXR. Anywhere you see CXR, mostly they are being written on the patient. Oh, manage way, fakwaha. Yes. It is known as the chest X-ray. Then we have the ECG. When we talk of the ECG also stands for electrocardiogram. So this is what these are most common ones that you are going to see at the ward, and these are some of them that we've talked about. I've already talked about most of them under pharmacology. This one is under the medical and the blood abbreviation. So I'll urge you to stick and stay with me. We are going to talk about a whole lot of them here.